Chair, Delegate Rodney Willett. Thanks for being here. I don't know if you call this speed dating or speed performances, but we are moving quickly, but we appreciate everyone's good work, and with that, we'll take the roll. Excellent. We have a quorum, and we will go right to our ACE staff to work through these bills.
Okay, thank you, Mr. Chairman. The first bill is House Bill 392. This is Delegate Askew's. It's a sickle cell disease screening program, including kidney cancer screening.
Mr. Chairman, I move to report.
Second.
We have a motion that's been properly seconded to report HB 392. Go on the board. And that reports by a vote of 7-0.
Mr. Chairman, next is House Bill 440 by Delegate Mehta. This would remove the option for the DMV commissioner to suspend someone's driver's license if they're delinquent in their child support payments. It also adds some reporting requirements of insurance carriers. DSS would see some federal reductions, especially with non-TANF collections. They would also have some systems costs.
Mr. Chairman,
Yes.
move to place 440 gently on the table.
Do we have a second? We have a motion that's been properly seconded to gently lay on the table HB 440. And that passes by a vote of 7-0.
And Mr. Chairman, the next bill is House Bill 560. This is Delegate Hope's bill related to the Administrative Process Act. It makes changes to the Supreme Court review of provisions in the APA. There is no fiscal impact on it as it stands right now.
Move the substitute.
Yes, thank you.
Second.
We have a motion that's been properly seconded to move the substitute. All in favor say aye. Aye. Opposed, no. That's before us.
Mr. Chairman.
Yes.
Move to report Bill 560
With substitute.
with substitute.
We have a motion that's been properly seconded to report with substitute HB 560. We'll go on the board. And that passes by a vote of 7-0.
The next bill, Mr. Chairman, is House Bill 605. This is your bill. There is a substitute.
Move to report the substitute, to adopt the substitute.
And the substitute would turn the bill into a Section 1 bill requiring the Joint Commission on Health Care to evaluate workforce in Virginia's nursing facilities.
Let's
Move to report as
get a motion to approve that substitute. You can do that first. We have a motion?
Yeah, it's been and seconded.
And second. All in favor?
Aye.
Aye. So that's before us, so now we can go.
I move to report the bill with the substitute.
We have a motion that's been, and we get a second?
Second.
Second. Motion's been properly seconded to report with substitute HB 605. Go on the board. Okay. And that reports by a vote of 7-0.
Mr. Chairman, the next bill is House Bill 631, Delegate Carlson's bill, and there is a substitute.
Move the substitute.
We have motion's been properly seconded to adopt the substitute. All in favor say aye. Aye. Any opposed? No, that's before us.
Yes, Mr. Chairman, this bill makes a number of changes related to the single pharmacy benefits manager that was directed to go into law last session, and it has a number of requirements, but the substitute does require DMAS to issue a request for proposal no later than January 1, 2027, and it also changes the reimbursement for the managed care program. As such, there would be a significant cost to apply the methodology in the fee-for-service program to the managed care program.
Yes.
Move to gently lay the bill on the table as substituted.
We have a motion that's been properly seconded to gently lay on the table HB 631 as substituted. We'll go on the board. And that motion carries by a vote of 6-1.
The next bill is House Bill 674. This is Delegate Maldonado's bill to have the Health Department collect and publish information on food insecurity on their website. There's minimal impact to
Move
the
to
Health
report.
Department.
We have a motion that's been properly seconded to report HB 674. We'll go on the board. And that reports by a vote of 7-0.
The next bill, Mr. Chairman, is 717. This is your bill that would, in terms of the nursing home applications for a change of operating license, there would be some penalties involved for those that do not report ownership changes and control to the health commissioner.
Move to report.
We have a motion that's been properly seconded to report HB 717. We'll go on the board. And that reports by a vote of 7-0.
Mr. Chairman, next up, we have House Bill 775 by Delegate Thornton, and we did receive a substitute.
Adopt the substitute.
We have a motion that's been properly seconded to adopt the substitute. All in favor say aye. Any opposed? That's before us.
Mr. Chairman, the substitute removes the prescribed definition of reasonable efforts and instead directs the board to adopt regulations regarding how the term should be used in the code and defined. Also directs the board to create regulations by July 1 of 2027 regarding visitation arrangements, and continues to make changes to protocol and requirements for removal order hearings and court cases for the termination of parental rights.
Mr. Chairman,
Yes.
move to table 775 as substituted.
We have a motion that's been properly seconded to gently lay on the table as substituted HB 775, and we'll go on the board. And that motion carries by a vote of 7-0.
Mr. Chairman, next we have House Bill 884 by Delegate Herring. This would both expand the eligibility of the percentage of income payment program as well as increase the benefit amount. The funding for this would come from non-general revenue collected from the universal service fee from Dominion and Appalachian Power Company customers.
Mr. Chairman, I move to report.
Second.
We have a motion that's been properly seconded to report HB 884. We'll go on the board. And that motion carries by a vote of 5-2.
Mr. Chairman, next we have House Bill 931 by Delegate Simons. This establishes certain requirements for recovery residences and directs DBHDS to adopt regulations.
Move to report.
We have a motion that's been properly seconded to report HB 931. Go on the board. And that motion carries by a vote of 7-0.
Next up, we have House Bill 1002 by Delegate Tran. This bill has no fiscal impact. It establishes.
Move to report.
We have a motion that's been properly seconded to report HB 1002. We'll go on the board. And that reports by a vote of 7-0.
The next bill, Mr. Chairman, is 1109. This is Delegate Hodges' bill. This requires DMAS to develop and the managed care organization and pharmacy benefit managers to comply with standardized methods for collecting and reporting data related to expenditures, rebates, and all the source of all cost components. There is a fiscal impact on the bill.
Move to gently table 1109.
We have a motion that's been properly seconded to gently lay on the table HB 1109. We'll go on the board. And that motion carries by a vote of 5-2.
Mr. Chairman, next we have House Bill 1174 by Delegate Carroll. This would increase the supplemental clothing allowance rate by 30% for children in foster care.
Mr. Chairman,
Yes.
move to lay 1174 gently on the table.
We have a motion that's been properly seconded to gently lay on the table HB 1174. We'll go on the board. And that motion carries by a vote of 7-0.
Next, we have House Bill 1366 by Delegate Carlson. This would allow the DSS Commissioner to issue corrective action plans for local departments of social services and temporarily assume control if they are not complying with their corrective action plan. There is a fiscal impact, but the funding was included in the introduced budget.
Move to report.
We have a motion that's been properly seconded to report HB 1366. So go on the board. And that motion carries by a vote of 7-0.
The next bill, Mr. Chairman, is 1434. This is Delegate Cole's bill. This directs DMAS to implement a provision for payment of Medicaid for nutrition services. It's fairly comprehensive. It does have a significant fiscal impact.
Move to gently lay this on the table, 1434.
We have a motion that's been properly seconded to gently lay on the table HB 1434. And we'll go on the board. And that motion carries by a vote of 7-0.
Next up, Mr. Chairman, is House Bill 1490 by Delegate Tran. This would establish the centralized intake system for reports of child abuse and neglect at DSS. There is a fiscal impact, but the funding was included in the introduced budget.
Move to report.
We have a motion that's been properly seconded to report HB 1490. Go on the board. There we go. And that motion carries by a vote of 7-0.
Last bill, Mr. Chairman, is House Bill 1511 by Delegate Fagans, and there is a substitute.
Move the substitute.
We have a motion that's been properly seconded to move the adoption of the substitute. All in favor say aye.
Aye.
Any opposed? No, that's before us.
Mr. Chairman, this bill would direct DSS to develop and implement the Fatherhood Initiative to recognize fathers as essential partners in child and family well-being. The substitute instructs that local departments of social services may perform the needs assessment instead of shall, as well as DSS may annually review how local departments are meeting the needs of the fathers. However, there is still a fiscal impact.
Move to table 1511
Second.
as substituted.
We have a motion to gently lay on the table HB 1511 as substituted, and we'll go on the board. And that motion carries by a vote of 7-0. Members of the subcommittee, thank you so much. Thanks to our expert staff. And with that, we are adjourned. And who is up next?
The full committee.
And we will be